Did you know that in 2025, over 7 million Canadian seniors could see their pensions, healthcare, and even housing directly affected by brand new laws? Some of these changes will put extra money in your pocket, while others could quietly take away benefits you've relied on for years. The truth is, most seniors don't even realize how fast these laws are shifting, and missing out could cost thousands of dollars or limit access to vital care. Imagine going to your pharmacy only to find out a medication you've taken for years is suddenly covered for free, or learning too late that your tax bill could have been hundreds of dollars lower if you knew about a new credit. These aren't small tweaks. They're major changes that could reshape daily life for seniors across Canada. So let's uncover the 10 new law changes in 2025 that you simply can't afford to ignore. Number 10. Transportation Accessibility Law Updates. Getting around as a senior isn't just about convenience, it's about independence and dignity. In 2025, Canada is rolling out stronger transportation and accessibility laws that aim to make daily travel safer, more affordable, and more reliable for older adults. For many seniors, these updates are long overdue. One of the biggest changes is the federal requirement for public transit systems, buses, trains, and even ferries to improve accessibility. That means clearer signage, better seating for seniors, ramps and lifts that actually work, and staff who are properly trained to assist passengers with mobility challenges. Imagine no longer worrying whether your walker or wheelchair will fit on the bus, or struggling to climb steep steps just to catch a ride. These new laws are designed to remove those barriers once and for all. Another key update is focused on rural and small-town seniors, who often face the greatest struggles with transportation. The government is expanding funding for community shuttle services and on-demand transit programs so seniors outside big cities don't feel trapped or isolated. If you've ever felt stuck at home because there's simply no way to get to a doctor's appointment, grocery store, or social gathering, these changes could be life-changing. There's also good news for seniors who still drive. Provinces will be required to follow stricter road safety and design standards, including clearer pedestrian crossings, better lighting at intersections, and longer walk signals. These small improvements may sound simple, but they can make the difference between feeling safe or anxious every time you step outside. And here's something many seniors will appreciate. Some provinces are introducing subsidies or discounted fares for seniors using public transit, taxis, and accessible ride-sharing programs. Yes, that means more affordable options to get around without relying on family or friends. These updates aren't just about transportation. They're about protecting your freedom to move, connect, and live fully. But here's the catch. The benefits will only reach you if you know how to apply for subsidies, report accessibility issues, and use the new programs in your community. So let me ask, would you take advantage of these new travel benefits if they became available in your area? Drop your answer in the comments. I'd love to hear how important transportation is in your life. And don't forget to like this video and subscribe so you never miss important updates about seniors' rights and benefits in Canada. Number 9. Healthcare wait time. Access reform. For years, one of the biggest frustrations for Canadian seniors has been the long wait times to see a specialist, get surgery, or even book a routine test. In some provinces, seniors have waited months, sometimes even over a year, for procedures that are critical to their health and quality of life. In 2025, the federal government is tying new healthcare funding directly to reducing wait times and ensuring that seniors can get faster, more reliable access to care. One of the main reforms is the creation of national benchmarks for how quickly patients should be seen. This means provinces will be required to track and publicly report how long seniors are waiting for things like hip replacements, cataract surgeries, and cancer treatments. For the first time, seniors and their families will be able to compare wait times across regions and hold healthcare systems accountable. Another major change is the investment in virtual care and telemedicine services, designed to ease the burden on overcrowded clinics and hospitals. For seniors in rural or remote communities, this can make an enormous difference. Instead of traveling hours to see a specialist, many will now have the option of secure video appointments, faster prescription refills, and online access to test results. This not only saves time, but also reduces stress and travel costs. The reforms also target the shortage of healthcare workers, which has been one of the biggest reasons for delays. New funding is going toward training and hiring more nurses, personal support workers, and doctors, especially in fields that serve a large number of seniors, such as geriatrics and home care. Over time, this should help reduce bottlenecks and improve the quality of care across the system. There's also an increased focus on preventive healthcare, including faster access to screenings, SUL, checkups, and wellness programs that can catch health issues before they become emergencies. By shifting resources toward prevention, the system hopes to keep seniors healthier for longer and reduce the overwhelming demand on hospitals. These reforms don't promise overnight solutions, but they represent a serious push to tackle a problem that has affected Canadian seniors for decades. With shorter wait times, more doctors available, and expanded use of technology, the goal is clear: to give seniors the care they need when they need it, without the endless delays that have too often defined the healthcare experience in Canada. Number 8. Tax credits for seniors. 2025 update. Taxes can feel complicated, but for seniors living on a fixed income, every dollar saved makes a difference. In 2025, the Canadian government is introducing updates to tax credits for seniors, giving many people new opportunities to lower their tax bills and stretch their retirement income further. These changes aren't just about numbers on paper, they can directly impact how much money is left in your pocket at the end of the year. One of the biggest updates is an expansion of the age credit, which provides tax relief to lower and middle-income seniors. The income threshold has been raised, meaning more seniors will qualify without being phased out as quickly as before. For those living just above the old cutoff, this could mean hundreds of extra dollars in tax savings. Another important change is with the medical expense tax credit. In 2025, the list of eligible expenses has been broadened to include more assistive devices, specialized home modifications, and certain caregiving services. This is especially valuable for seniors who spend large amounts on prescriptions, mobility aids, or in-home care. Now, more of those costs can be claimed, easing the financial strain of staying healthy and independent. The Canada Caregiver Credit has also been updated to provide greater support for seniors who depend on family members for care. This credit will now cover a wider range of caregiving situations, including part-time support or care provided by extended family. For families sharing the responsibility of looking after an aging parent, this update can provide meaningful tax relief and recognition of the financial pressures caregivers face. In addition, some provinces are enhancing their own senior-specific credits to align with federal changes. For example, property tax deferrals and home accessibility tax credits are becoming easier to qualify for, making it less costly for seniors to stay in their homes as they age. Together, these updates show a clear effort to address the financial challenges seniors face. While none of the credits alone will completely remove the pressure of rising costs, the combined effect can add up significantly over the course of a year. For seniors watching every expense, these credits can mean the difference between struggling to cover bills and having just enough breathing room to live more comfortably in retirement. Number 7. Digital Services, Online Safety Law. In today's world, more and more seniors are going online to pay bills, connect with family, shop, and even manage their healthcare. But with this digital shift comes a serious risk: online scams and fraud. In recent years, thousands of Canadian seniors have lost millions of dollars to phishing emails, fake tech support calls, and fraudulent investment schemes. To address this growing problem, the government has introduced stronger digital services and online safety laws in 2025, aimed at protecting vulnerable populations, especially older adults. One of the biggest updates is the requirement for banks, telecom companies, and major online platforms to implement tougher security standards. This means stronger login protections, clearer warnings about suspicious activity, and faster ways to report fraud. Seniors will also see improvements in fraud detection tools, making it harder for scammers to slip through unnoticed. Another important aspect of the law is focused on education and awareness. Internet service providers and financial institutions are now obligated to provide clear, easy-to-understand resources that teach seniors how to spot and avoid scams. Instead of burying warnings in fine print, companies must actively share information about common fraud tactics, such as fake Canada Revenue Agency calls or emails asking for banking details. The law also increases penalties for criminals who specifically target seniors online. This includes harsher sentencing for those caught running fraud schemes that exploit older Canadians. By making the consequences more severe, the government hopes to deter scammers who view seniors as easy targets. Additionally, there are new measures to ensure that government digital services, such as applying for benefits, filing taxes, or accessing healthcare information, are designed with seniors in mind. This means simpler interfaces, stronger privacy protections, and assistance options for those who struggle with technology. For seniors who rely on the internet to stay connected and independent, these changes could provide much-needed peace of mind. Instead of feeling anxious every time an email arrives or a phone rings, seniors will now have more tools and protections on their side. While no law can completely eliminate the risk of online fraud, these reforms represent a big step toward making the digital world a safer place for Canada's aging population. Number 6. Housing rent control changes. For many seniors, the cost of housing has become one of the greatest sources of stress. Whether renting an apartment, living in a retirement community, or struggling to keep up with rising property taxes, the financial weight of housing often consumes a large portion of a fixed income. In 2025, new housing and rent control measures are being introduced to ease this pressure and give older Canadians more stability in their living situations. One of the most significant changes is the tightening of rent control regulations across several provinces. Landlords will face stricter limits on how much they can raise rent each year, ensuring that seniors are not suddenly priced out of their homes. For those living in long-term rental housing, this provides much-needed predictability and security, allowing them to budget with greater confidence. The federal government is also investing in affordable housing projects specifically designed for seniors. These developments focus on safe, accessible units that are close to essential services like healthcare, grocery stores, and transit. By targeting seniors directly, the goal is to reduce isolation and create communities where older adults can thrive without the constant fear of eviction or unaffordable rent increases. Another change addresses homeowners who want to age in place. Expanded programs will provide financial assistance for home modifications such as wheelchair ramps, stair lifts, and accessible bathrooms. Instead of being forced into institutional care before they are ready, seniors can stay longer in the homes they love while maintaining independence. Property tax relief is also being strengthened, with more provinces offering deferral programs that allow seniors to delay payment until the home is sold. This change eases the burden on retirees who are house rich but cash poor, giving them a chance to enjoy retirement without being squeezed by ever-rising taxes. Together, these measures aim to create a housing system that supports seniors instead of leaving them behind. Housing is more than just a roof over one's head. It's the foundation of security, dignity, and peace of mind. With these new laws, Canada is taking steps to ensure that older adults can live where they feel safe and comfortable without the constant fear of losing their home to rising costs. Number 5. Long-term care standards law. Few issues have exposed the struggles of seniors more than the state of long-term care homes in Canada. The pandemic revealed heartbreaking stories of neglect, understaffing, and unsafe conditions that left many families fearful for their loved ones' well-being. In response, the government is rolling out a new long-term care standards law in 2025, designed to raise the bar for safety, dignity, and quality of life in nursing homes and similar facilities. At the heart of this law are national care standards that every facility must follow, regardless of the province or territory. These include requirements for minimum staffing levels, stricter training for caregivers, and stronger infection prevention measures. For seniors, this means a greater chance of receiving consistent, compassionate care rather than being left unattended or rushed through basic daily needs. Another key change is the introduction of resident rights protections. Seniors in long-term care will now have clearer guarantees around privacy, freedom of choice, and respectful treatment. Facilities will be legally obligated to involve residents and their families in care planning, ensuring decisions are not made behind closed doors but instead with the individual's preferences and dignity in mind. The law also places heavier accountability on operators. Facilities that fail to meet the new standards face tougher inspections, financial penalties, and even the risk of losing their licenses. This shift is designed to end the culture of neglect that has too often been brushed aside with little consequence. Families will have more transparency, with public reporting on compliance and quality indicators that reveal whether a facility is truly living up to expectations. In addition, there will be a push toward integrating more healthcare services directly into long-term care homes, such as regular visits from nurse practitioners and mental health professionals. This change aims to reduce hospital transfers and ensure residents receive timely medical attention without unnecessary stress or delays. The Long-Term Care Standards Law represents more than just policy. It is a promise to seniors that their final years will be lived with safety, respect, and dignity. For families, it offers reassurance that loved ones will not be forgotten in a broken system, but cared for in an environment that truly values their well-being. Number 4. Dental care expansion for seniors. A healthy smile is more than just cosmetic. It's essential for overall health. For too long, many Canadian seniors have had to put off dental visits because of the high cost, leading to untreated cavities, gum disease, and even serious health complications. In 2025, the rollout of the Canadian Dental Care Plan is expanding further, bringing a wave of relief for seniors who have struggled to afford proper dental care. This expansion means that millions of seniors will now qualify for low-cost or even free dental services, depending on their income level. Services covered include cleanings, fillings, dentures, and even certain restorative procedures. For seniors living on a fixed income, this could mean the difference between suffering in silence with dental pain or receiving the care they need without financial worry. Another positive change is the focus on preventive care. Instead of only covering urgent procedures, the plan emphasizes regular checkups and cleanings to catch problems early. Preventive care not only protects oral health, but also reduces the risk of related health issues, such as heart disease, infections, and diabetes complications. By making these services more accessible, the plan encourages seniors to take care of their teeth before problems become emergencies. The dental expansion is also designed to be more accessible and senior-friendly. Application processes are being simplified, with assistance available for those who find forms or online portals confusing. Clinics across the country are preparing to accept more patients under the plan, ensuring shorter wait times and more availability. Importantly, the program extends beyond just the basics. For seniors who rely on dentures or other oral devices, coverage now includes fitting, maintenance, and replacement. This is especially significant for older adultos who have lost teeth and struggle with eating or speaking, as it restores not just function but also confidence in social situations. For many seniors, this expansion represents more than just dental work. It's a chance to reclaim health, comfort, and dignity. No one should have to choose between paying for groceries and fixing a painful tooth. And with these new measures in place, fewer seniors will have to make that heartbreaking choice. The 2025 dental care expansion is a long-awaited step toward ensuring that older Canadians can smile, eat, and live with confidence, without the constant worry of unaffordable dental bills. Number 3. New drug coverage expansion. Prescription medications are a lifeline for many seniors, but they are also one of the biggest financial burdens in retirement. Too often, older Canadians have been forced to make difficult choices between paying for groceries, covering utility bills, or filling a prescription. In 2025, the federal government is moving forward with a major step in healthcare reform. The National Drug Coverage Expansion, often referred to as the first phase of Universal Pharmacare. This new program focuses on providing coverage for a wide list of essential medications, many of which are commonly prescribed to seniors. These include drugs for heart disease, diabetes, high blood pressure, and other chronic conditions that affect millions of older adults. By reducing or even eliminating out-of-pocket costs for these medications, the reform is expected to improve both health outcomes and financial stability for seniors. The changes also aim to make access to prescriptions more consistent across Canada. Until now, coverage varied widely from province to province, leaving many seniors at a disadvantage simply because of where they lived. With the new federal framework, seniors will see greater fairness and uniformity in drug benefits, no matter which province or territory they call home. Another important aspect of the reform is its focus on generic medications. By prioritizing lower-cost but equally effective alternatives, the government can stretch funding further while still ensuring seniors receive safe and reliable treatment. This not only helps control costs, but also allows the program to cover a wider range of medications over time. For seniors managing multiple prescriptions, the expansion offers peace of mind. Programs will include better coordination between doctors, pharmacists, and insurers to reduce duplication, prevent dangerous drug interrogation, and ensure that patients are following the right treatment plans. This is particularly valuable for older adults juggling complex health needs. Beyond affordability, the law also emphasizes accessibility. Pharmacies will play a central role in educating seniors about which medications are covered and how to enroll in the program. Seniors who may have felt overwhelmed by complicated systems in the past will now have clearer, simpler pathways to get the medication support they need. The new drug coverage expansion is more than just a financial policy. It's a promise that no senior should have to suffer or cut corners when it comes to their health. By making essential medications affordable and accessible, the 2025 reforms aim to give seniors the security and stability they deserve. Number 2. Canada Pension Plan (CPP) Contribution Payment Changes. The Canada Pension Plan (CPP) is one of the cornerstones of retirement security for Canadians, and in 2025 it is undergoing important changes that affect both current retirees and those still working toward retirement. For seniors already collecting CPP, the most immediate update is the adjustment to monthly payments to better keep pace with inflation. Rising costs for food, housing, and healthcare have been straining fixed incomes, and this increase is designed to provide some relief by ensuring benefits don't lose value over time. Even modest adjustments can make a noticeable difference in day-to-day budgeting. For Canadians still working, the contribution side of CPP is also changing. Starting in 2025, there will be an additional contribution tier for higher income earners, often called the second earning ceiling. This means those earning above the standard threshold will contribute more, but they will also receive larger benefits when they retire. While this primarily affects workers rather than current seniors, it represents a long-term shift towards strengthening the pension system for future generations. Another key reform is the focus on fairer distribution of benefits. The government has introduced adjustments that aim to provide better support for seniors who may have spent years out of the workforce, often due to caregiving responsibilities or health challenges. These new measures will ensure that periods of low or no income don't drastically reduce lifetime CPP benefits, offering greater financial security for those who gave unpaid time to family or faced health struggles. For current retirees, the CPP disability and survivor benefits are also being improved. The eligibility criteria are being updated to make it easier for vulnerable seniors and widows or widowers to access support. This NJ is particularly significant for older Canadians who rely on these benefits as a vital part of their income. Overall, the 2025 CPP changes are part of a larger effort to modernize Canada's pension system. They aim to balance immediate relief for retirees with long-term stability for future generations. While contributions for workers will gradually rise, seniors can take comfort in knowing that their benefits are better protected against inflation and that the system is being strengthened to continue supporting Canadians for decades to come. Number 1. Old Age Security, OAS. Increase in 2025. For millions of Canadian seniors, Old Age Security, OAS, is the backbone of retirement income. It's the monthly benefit that helps cover essentials like groceries, rent, and medical costs. In 2025, important changes are coming to OAS that aim to give seniors more financial stability in the face of rising living expenses. The most notable change is the increase in OAS payments. These adjustments are tied to inflation, meaning benefits will rise to match the higher cost of living. With food prices, energy bills, and housing costs climbing, this increase is designed to make sure seniors don't fall behind. Even a modest bump in monthly payments can provide a sense of relief, allowing retirees to better manage day-to-day expenses without stretching every dollar to the breaking point. In addition to the inflation adjustment, eligibility for certain OAS enhancements is being broadened. Seniors aged 75 and over who already receive a slightly higher benefit will see their top-up continue and grow. This reflects the reality that older seniors often face higher healthcare expenses and increased costs associated with mobility, caregiving, and medications. Another meaningful update is the expansion of support for low-income seniors through the Guaranteed Income Supplement, GIS, which is closely linked to OAS. In 2025, income thresholds are being raised, allowing more seniors to qualify for extra financial help. This is particularly important for single seniors, who are often at greater risk of poverty in retirement. By adjusting these thresholds, the government is working to ensure that vulnerable seniors are not left behind. Seniors will also benefit from improvements to the application and delivery process. Many Canadians who are eligible for OAS or GIS sometimes miss out due to confusing paperwork or lack of awareness. In 2025, the government is automating more of the enrollment system so that seniors are enrolled automatically when they become eligible, reducing the chance of missing out on money they deserve. These OAS updates reflect a commitment to protecting seniors' dignity and independence. While the increases may not erase all financial worries, they provide an important cushion against the rising costs of everyday life. For seniors across Canada, the 2025 OAS changes are not just numbers. They are a promise of greater security and peace of mind in retirement. The year 2025 is bringing some of the biggest changes to seniors' lives in Canada. from pensions and healthcare to housing, safety, and everyday costs. Some of these updates will put extra money in your pocket, while others require you to take action so you don't miss out on benefits you've earned. Now, I'd love to hear from you. Which of these 10 changes do you think will impact you the most this year? Share your thoughts in the comments below, and don't forget to like this video, subscribe to the channel, and hit the bell so you never miss important updates.